It's World Hypertension Day, and the theme is Measure Your Blood Pressure Accurately, Control It, Live Longer. But the World Health Organization is asking for global attention on combating poor awareness across the world, especially in low and medium income areas. Senior correspondent Jacqueline Ogo takes a look at the ailment hypertension, and we'll be back with business.
Heart-related diseases are known as cardiovascular diseases, and hypertension is one of them. They are the leading cause of death globally. The World Health Organization says 30% of the world's population are living with hypertension. It also says Nigeria has at least 76.2 million people living with the ailment. Doctors say people with hypertension may not feel the symptoms, and it gets very deadly when not identified and treated on time. That's why it is called the silent killer. Dr. Ramon Muronkola is a consultant cardiologist who treats heart-related diseases at the Lagos University Teaching Hospital, LASUT. I asked him if hypertension can lead to other health complications.
Hypertension is a condition that can affect almost all the organs in the body. And this is understandable because we are referring to pressure in the pipes that carry blood around the body. Every tissue in the body should be supplied with blood. And those pipes take blood to those organs. Now, if the pressure is high, over time, it can lead to damage to those pipes. Complications of hypertension is likely to happen in such individual. And what are these complications? If you talk about the brain, this person is prone to developing what we call stroke. And stroke refers to blockage of blood vessels in the brain. Blockage of blood vessels in the brain or burst in the blood vessel in the brain. The male organ has pipe that takes blood to it for it to function. If that pipe also has some damage, it can lead to erectile dysfunction. So almost all organs in the body can be affected by hypertension in one way or the other.
Hypertension is expensive to treat. Doctor says self-medication in desperation only worsens it.
For example, a lady of childbearing age, we don't want to give some drugs for hypertension because we know that some of them may have effect on pregnancy. This individual will not know when he's self-medicating. That's one of the problems. You take a wrong drug. The earlier people are able to be diagnosed, the earlier they get started on their treatment, the more they get adhered or comply with their treatment, the less likely that they can develop complications of hypertension.
How important is sleep in the healing process of a hypertensive patient?
Poor sleep or inadequate sleep has lots of issues, lots of complications that can come with it. Now, poor sleep can push you to developing elevated blood pressure, even elevated sugar.
A healthy eating habit with less intake of salt, more body exercise, vegetables, fruits, less carbohydrates, alcohol, smoking are amongst the recommendations for a healthy lifestyle for the hypertensive. Jacqueline Ogo, TVC News, Lagos.